Welcome back. Health officials are raising concerns as measles cases continue to climb across the country. And so far this year, Washington has had 26 confirmed cases, and more than half of them are in Snohomish County alone. Joining us now to talk about the rise in measles cases is State Health Officer Dr. Tao Kwangget. Thank you so much for being here today.
Thank you for having me.
Okay, let's jump right into this. Can you explain what measles is and how it actually spreads?
So measles is a rash caused by the measles virus, and it's spread through the air. So when a person has a measles infection, they actually become contagious 4 days before they develop fever and rash. And measles can be very serious. For every 1,000 infections, there can be 1 to 3 deaths due to brain inflammation or pneumonia. And that's why it's so important to get vaccinated with the MMR vaccine, because that's our best protection against infection.
All right, so let's talk about the cases we've seen this year in Washington. The Department of Health says there have been 26 cases across 4 counties. Were these all linked to the same outbreak or a couple of different ones? And what's the outlook for them?
Yes, it's very concerning because, we're just a few months into 2026, and already we have more than twice the number reported in all of 2025. And this year we are seeing cases linked to outbreaks in other states. So before we used to worry most about measles being introduced from other countries, but now increasingly we're seeing measles imported from other states. And so that's why it's so important for people to get up to date on their MMR vaccine.
Okay, and are your findings showing that out of the 26 cases across the state, were any of them vaccinated?
All of the cases that were reported this year were either unvaccinated or had unknown vaccination status.
Okay, so I know you just briefly touched on it, but how important is it to get vaccinated, and does it completely protect against the measles?
Measles vaccine is extremely effective, and measles vaccine is one of the most well-tested vaccines around. And when you're up to date on MMR vaccine, you're more than 95% protected against measles. So if you're not up to date, be sure to visit your doctor's office or pharmacy to get up to date as soon as you can, because you just never know when you and your family might be exposed to measles.
And as you said before, when you're exposed to it and you're unvaccinated, and this can be life-threatening, how quickly do you have to react when you realize you have this and maybe you haven't been vaccinated?
If you haven't been vaccinated and you know you're exposed to measles, talk with your health department or your doctor right away, because there are treatments that can be given within 72 hours of exposure to prevent infection. So the best protection is to get up to date on MMR vaccine, but if you're unvaccinated and are exposed, talk to your doctor or your health department right away.
Okay, so are you surprised that there have been more than 1,000 cases of measles reported alone this year?
It's very concerning, and I think it's because we are seeing lower rates of routine vaccination. And so really the key to decreasing cases and decreasing outbreaks is to get more and more people up to date on their routine vaccinations. So
in your opinion, everybody should be getting vaccinated, and what do you say to those who are not willing or wanting to do it? Do you try to talk to them about the kind of greater good of the spread of the people?
Well, many people who are reluctant to get vaccines have real valid concerns about the vaccine. And there's a lot of conflicting information out there. Some of it's not accurate. And so if you have concerns about vaccine, the best thing to do is talk to a trusted healthcare provider, your doctor or your pharmacist, who can give you accurate information to help you make the best decision for you and your family.
And I know it's been somewhat confusing because of some of the guidelines coming from the CDC and the government of what to get vaccinated for or to not. Are you seeing that because people may not be getting vaccinated, this is flaring up, and we're seeing the uptick in this where we've kind of had it suppressed for years?
That's right. We have seen vaccination rates on the slow decline in recent years, and the fewer people that are vaccinated, the greater the risk of cases and outbreaks. So the way to reverse this trend is to get more people vaccinated against diseases like measles, and by doing that, we can reduce cases and outbreaks against these very serious infections.
Anything else, Dr. Tao, you would like to tell our viewers out there?
One important thing is if you're traveling, whether it's to another state or another country, check with your doctor to see if there's a measles outbreak going on in your destination, because if there are, your doctor may recommend either an extra dose of MMR or an early dose of MMR just for some extra protection while you're traveling. And be sure to do this at least 2 weeks before you leave, because it takes that long for your body to develop a protective response from vaccination.
All right, Dr. Talquan, thank you so much for joining us today and giving us a little bit of advice and your insight.
Thank you for having me.
Okay.